I think my biggest message would be it's time to get healthy Americans back out circulating in the public. The way to develop an immunity is to get healthy people out circulating, doing what healthy people normally do. I'm Dr. Joel Yeager, board-certified family physician, and my wife, Dr. Luann Yeager, is also a board-certified family physician together with me. We made the choice to keep our office open throughout this entire pandemic. I had a phone call after hours. He said, Dr. Joel, he said, I'm finally back to work after many weeks of not being at work. And now one of my coworkers has tested positive. I don't think the coworker had really many symptoms. He said, I don't have any symptoms at all. He said, what should I do? And I said, well, I can give you the CDC recommendation, which would basically be to go home and isolate yourself for the next 7 to 14 days, which means you're out of work. Or I can give you my recommendation. You're not symptomatic. You're finally back to work. Even if you do become symptomatic, we now know that most people fight this virus and do absolutely fine with little to no effects. So we had about a 10-minute conversation, and at the end, he said, well, Dr. Joel, I'm so glad to hear this. He said, this just puts my mind at ease, because he said, all I hear is what I hear on the news media, and it makes me really frightened. We have never been a fan of telemedicine because you can't examine the patient. About 2-3 weeks ago, an Amish mom called in and said her 10-year-old son was having difficulty breathing, and he had a bit of a cough. He was short of breath, and she wanted us to prescribe a nebulizer treatment for him, which in certain cases we'll do that over the phone if we know the history. But this happened to be someone that we had actually not seen yet. So my wife said, well, the only way to really address that is to have you come in. So have the little fella come in. He definitely was working pretty hard to breathe. When my wife did the exam, she found no breath sounds at all on the right side of his lung, and it was very dull to percussion, which is a clinical finding. So thankfully, some of our local facilities still are open, so we were able to get a chest x-ray. It showed that lung was completely whited out, and ended up in a tertiary care hospital's ER. We were able to get him there, thankfully. The whole lung was completely collapsed, and the little fella ended up having leukemia. Now, if we had not had our office open and we had done the telemedicine approach, we would have completely missed that, because there would have been no way that could have been diagnosed over the phone. I can only imagine if we had tried to do it over the phone, what could have happened at home in terms of his overall health status. So that had a good outcome, which could have otherwise been very poor had we done things differently. I think my biggest message would be it's time to get healthy Americans back out circulating in the public. The way to develop an immunity is to get healthy people out circulating, doing what healthy people normally do. And that's backed up actually by the facts. The way to get an immunity in a population to a disease that's relatively as benign as this, it's to get healthy people circulating. In worst case scenario, kids do pass it around at school. Well, they'll develop an immunity to it. I can't imagine a first grader, kindergartner with a mask on 8 hours a day at school, not being allowed to participate in field trips. Certainly schools are about education, but there's also a huge social component. And all of these restrictions will have huge social implications on children.